All right, let's dive into a medical innovation that is so fundamental to our lives we barely even think about it. And yet, it single-handedly transformed surgery from, well, an act of brutal butchery into the modern miracle we know today. Of course, I'm talking about anesthesia.
So, to really get a handle on this revolution, you first have to understand the sheer terror. I mean, this quote just says it all, doesn't it? The state of mind of a person awaiting surgery would be similar to that of a person about to be tortured or executed. Before anesthesia, surgery wasn't a procedure. It was an ordeal you might not even survive, not because of the illness, but from the shock and the pain of the cure itself.
I mean, look at this. It paints a picture of a completely different world, and honestly, it's horrifying. Surgeons weren't prized for their precision, they were prized for their speed. They were basically sprinters. The best ones could amputate a leg in under a minute. Why? Well, because every single second counted. That was one less second of unbearable agony for the patient who was being physically held down and gagged. And get this, operating rooms were often put on the top floors of hospitals, not for the great view, but to muffle the screams so they wouldn't echo through the rest of the wards. Just unbelievable.
Okay, so for centuries, this was the reality. The brightest minds in medicine knew this was a huge problem, right? They absolutely tried to solve it, but as we're about to see, their attempts were, well, tragically ineffective.
I mean, people tried everything. You go way back, ancient physicians were using plant extracts like mandrake root and opium. Later on, alcohol was a go-to. But here's the thing. These barely even scratched the surface of surgical pain. Sure, they might have made a patient a little groggy, maybe easier to hold down, but they did not stop the agony of the knife. There were even these things called soporific sponges, soaked in a cocktail of drugs, but modern experiments show they probably had zero anesthetic effect. So the bottom line, the problem of pain was completely unsolved.
And this is where the story takes a really bizarre turn. Because the solution didn't come from some sterile laboratory or a fancy university. Nope, it came from a party.
So back in the early 1800s, inhaling ether or nitrous oxide, laughing gas, was actually a popular form of entertainment. They had these things called ether frolics and laughing gas parties. And at these parties, a few really sharp observers started to notice something strange. People would get rowdy, they'd stumble around, fall, get all kinds of bruises. But at the time, they felt zero pain. And this is that incredible leap in logic, right? Step 1, you're at a party inhaling some recreational gas. Step 2, you notice that people are getting injured, but not feeling any pain until the next day. And then, step 3, the question, the big one. Could this party drug, actually be used in medicine? Could this be the key to unlocking painless surgery? I mean, it was a totally wild idea, but it was the idea that was about to change everything. But here's the thing. This breakthrough wasn't some clean, simple eureka moment. Oh no, it was a messy, high-stakes, competitive, and pretty bitter race between several different people who all saw the potential, and they all wanted the credit. Okay, just look at how close together all these events are. It's wild. In 1842, you've got Dr. Crawford Long in Georgia using ether in a surgery after seeing it at one of those parties. But he doesn't publish his findings. He doesn't tell anyone. Then, just 2 years later, a dentist named Horace Wells tries nitrous oxide for a tooth extraction, but his big public demonstration is a total disaster. The patient cries out in pain. Then, in 1846, another dentist, William Morton, pulls off a successful, absolutely game-changing public demonstration using ether. So it raises the huge question, who gets the credit? The first person to do it in private, or the first person to prove it to the world? And just to add another layer of drama to the whole thing, Morton and his partner, a doctor named Charles Jackson, didn't just announce they were using ether. Oh no, they tried to patent it. They actually disguised it by mixing it with some aromatic oils, called it lithium, and tried to cash in on their big secret. Well, the medical community was completely outraged and pretty much forced them to reveal what it really was. It just goes to show the intense ambition and conflict that was right there at the heart of this discovery. And this just perfectly sums up the chaos that followed. For the next 75 years, it was a total mess. Different institutions kept giving the official credit to different people. You had the U.S. Congress debating between Jackson and Long. Then the American Medical Association comes out and says, nope, it was Wells. NYU's Hall of Fame says it was Morton. It wasn't until 1921, decades later, that the American College of Surgeons finally landed on Long.
What this really tells you is that scientific discovery is almost never a straight line. It's usually this tangled, messy web of competition, arguments, and near misses, all happening at the same time. Okay, so the secret was finally out. Ether was the key. But, discovering the substance was one thing. Figuring out how to use it safely and effectively, that was a whole different ballgame. The next phase was all about perfecting the procedure.
See, ether wasn't perfect by any means. It was really harsh on the lungs, it smelled awful, and it often made patients vomit. So pretty soon, a new contender entered the ring: chloroform. Now, chloroform was more pleasant for the patient, and it turned out to be really effective in obstetrics. But, and this is a big but, the downside was huge. It was way more dangerous, with a death rate 5 times higher than ether, not to mention the risk of serious liver damage. So suddenly, doctors were facing this really tough trade-off between patient comfort and patient safety.
And speaking of childbirth, chloroform ran into this huge wall of religious opposition. Some people in the church were actually citing the Bible, saying, "In sorrow thou shalt bring forth children," that pain in childbirth was divinely ordained. Well, that argument pretty much died overnight when the most famous woman in the world, Queen Victoria, used chloroform during the birth of her 8th child. Once it had that royal stamp of approval, all those objections just faded away. At the same time, the way they actually delivered the anesthetic was evolving at an incredible pace. I mean, it started with something as crude as Crawford Long just pouring ether onto a towel and holding it over the patient's face. Then you get Morton's little glass globe with a sponge inside. But the real breakthroughs were devices like Snow's inhaler, because for the first time, it allowed doctors to control the drug's concentration. Then you get Clover's bag, which held a pre-mixed bag of anesthetic and air, and eventually Shipway's apparatus for mixing multiple gases. Every single step was a move towards more precision, taking anesthesia from a dangerous art form to a controlled science.
So the next huge leap forward was finding a more direct route to the lungs. This is what we call endotracheal anesthesia. The very first attempt, back in 1869, actually required making an incision in the windpipe to insert a tube. Yikes. But by 1880, they'd figured out how to pass a metal pipe down the throat, no cutting needed. And by 1919, they were using flexible tubes inserted through the nose or mouth. This was absolutely revolutionary because it suddenly opened the door for safe, complex surgery on the head, neck, and chest, areas that were just too risky before. Of course, you don't always need to knock a patient out completely for every procedure, right? So running parallel to all of this was the development of local anesthesia. This story starts with the coca plant, used by Peruvian Indians. Scientists isolated its active ingredient, cocaine, and realized it could numb specific parts of the body. It was used for things like eye surgery or numbing the throat. Eventually, of course, it was replaced by much safer synthetic drugs like novocaine, which I'm sure most of us have gotten friendly with at the dentist's office. So you put all of these pieces together, the discovery, the competition, the refinement of the drugs, and the delivery systems. What was the ultimate result? Well, it is absolutely no exaggeration to say it changed everything. I mean, everything about the practice of medicine.
This chart really just says it all. Before anesthesia, the most important thing for a surgeon was speed. After, it was precision. Before, surgeries were simple, external things. After, they could be incredibly intricate and internal. The patient went from being a struggling victim, literally fighting on the table, to an unconscious patient. And maybe most importantly, the goal itself changed. It went from just surviving the ordeal to actually restoring health.
And the ripple effect from that fundamental shift was just immense. All of a sudden, patients weren't terrified of the operating table anymore, so surgery became a far more common and practical solution for all kinds of problems. With time no longer the enemy, surgeons could finally slow down, be meticulous, and develop brand new, complex techniques. This, in turn, elevated their skill and their status in the medical world. It really is this simple. Without anesthesia, there is no modern surgery. Period. So you think about it. Anesthesia conquered what was once the impossible barrier of surgical pain. It just completely redefined what was possible. And it really makes you wonder, when you look at the challenges we face today, from incurable diseases to the deep mysteries of the human brain, what is the next great impossible barrier that some future breakthrough is finally going to tear down for good?